first thing we're going to do is the knee-jerk reflex, and we need to assign jobs. So we need a subject, so that's you, who wants to be the computer operator. All right, so Danielle, what's your job as the computer operator?
My job is to press start and stop and keep things vertically auto-scaled.
Awesome. Okay, so we need a helper. All right, what's your job?
Coordinate between the computer starter and the striker and give them a thumbs up and to go.
Awesome. All right, so you're going to be the striker in finding the stimulus. So the first thing we need to do is to make sure that our subject has a reflex. This is before we put anything on. Okay, so first thing we have to do is find the patellar tendon in the proper place to strike the knee. So we want to look at the kneecap, and the patella comes down into an apex. So we have a bony apex here. And if you go down here, there's a tibial tuberosity, which is the bony prominence here. The tendon lies between those two pieces of bone. And if you run your thumb gently between the two, there's kind of an area about halfway through that gives more than the rest of the tendon. That's typically your sweet spot. Not for everybody, but that should give you a general area of where to strike the knee. Okay, so we're going to have Reed find that spot. Okay, so have your subject close your eyes, and we're just going to see if we can find your reflex. Just relax. Okay, that's pretty good. Let it come to a complete stop before you stimulate it again. All right, looks like you found a sweet spot, so go ahead and put a small mark there. It doesn't have to be that big. Just want to be able to find it again. All right, so this is the last time you're going to use this hammer. The rest of the time you're going to use the BioPAC hammer, so I'm going to set this over here. All right, so the first thing we need to do is place the goniometer. So we'll have our subject slide off the table and stand up, shoulder width apart, with your knees kind of straight. All right, so go ahead and grab the loose wire to keep it out of the way while they're putting the straps on. So first of all, we want to find the base of this is triangular shaped. We want to find the flat side of each of these green ends, okay? So go ahead. This is going to be parallel to the femur, about just above the knee. And we want it to be fairly snug, not too tight to cut off the circulation, but tight enough that it won't slip. Good. Now we're going to position the bottom strap so it's flat up against the fibula. Okay? So once that's in place, we're going to have her slide back up on the table, and we're going to have her bend her knee a couple times. We're looking for kinks. So what we want to do is we want to make sure that this spring is going along the natural curve of the knee and it's not kinking when she straightens or bends. So go ahead and drop it. Okay, that's pretty good. All right, it's got a nice natural bend. I would probably slide this up just a little bit more so we don't get the kink right here. Try it one more time. Okay, good. So the next step is to put on the electrodes. So we need to clean a spot with ethanol down here on the edge of the femur. You can feel the bone, the femur. This is going to be your ground. And then we want to get the head of the muscle up on the top. So we're going to have you go ahead and flex. You can see that we've got the head of the central quadricep. We want to place one just below the strap and one about 4 or 5 inches above. So we need to clean those spots really well. You can relax to get all the oils off the skin. Don't be afraid to scrub them. The skin should be pink. Especially with girls that have shaved their legs left, if you put lotion on after, we need to remove that lotion. So don't be shy. Okay, it's really good. It's really important that we get a clean contact. Okay, so once the alcohol is completely dried, we're going to place a lead in each spot. Okay, so now we need to attach the leads to the electrodes. So the black one is the ground, which is the one that goes on the inside of the knee. And once you get this attached, you want to make sure that you rotate the wire so the wire goes up the leg and does not interfere with the knee joint. Red is in the middle and white is on top. You can think about it as smoke over fire. The smoke is always going to be the highest, the white. Okay, so we want to make sure these are rotated, and if you have a lot of excess, you can actually take the clip that's on the electrode lead set and clip it to their shorts or shirt somewhere on their torso. And that'll keep it, if it falls off, it'll keep it from pulling the electrodes.